Monkeypox. Normally, monkeypox is a enveloped double-strand DNA virus that belongs to orthopoxvirus genus of Poxoviridae family. Now, incubation period for monkeypox is around 6 to 13 days but can range from 5 to 21 days, and period of communicability is 1 to 2 days before the rash to until all the scab fall off get subside. Then mode of transmission is human to human transmission, to occur primarily through the large respiratory droplets. And second mode of transmission is animal to human transmission, may occur by bite or scratch of infected animal like small mammals including rats, squirrel. Uh, uh, like what are called suspected case. A person of any age having history of travel to affected countries within last 21 days, presenting with an unexplained acute rash and having one or more symptoms like swollen lymph node, fever, headache, body ache, having generalized weakness. Like confirmed case, a case which is lab confirmed for monkeypox virus by detection of unique sequence of viral DNA either by PCR or sequencing. Like what are the clinical features? The clinical features are common symptoms and signs are first stage is prodrome for 0 to 5 days. In that patient having fever, lymphadenopathy, that is lymphadenopathy uh, typically occurs with fever onset, periauricular, cervical, inguinal or axillary, whether it is a unilateral or bilateral. Then third one is headache, muscle ache. Next, symptoms come under prodrome stages: chills and sweat, sore throat and cough. Now skin involvement, that is rash. Lesions are often described as painful until the healing phase when they become itchy. Now stages of rash: first lesion on tongue and mouth is anthem. Now macule starting from face spreading to arm, leg, palm and soles within 24 hours. Then the rash goes through a macular, papular, vesicular and pustular phase. The classical lesion is vesico-pustular phase. Involvement by area: face is 98%, palm and sole is also 95%. By third day lesion progress to papule. By fourth to fifth day lesion become vesicule. By 6 to 7 day lesion become pustular, sharply raised, filled with opaque fluid. By the end of second week they dry up and crust. Then scab remain for a week. The skin manifestation depends on vaccination status. What are the differential diagnoses for monkeypox? That is varicella, chickenpox, herpes zoster, measles, secondary syphilis, hand foot mouth disease, and also molluscum contagium. And mostly complications are secondary infections, pneumonia, sepsis, encephalitis, or corneal involvement may lead to loss of vision. Then how to diagnose? Uh, in a symptomatic patient, observe for the development of any sign and symptom for 21 days. Symptomatic having rash phase and recovery phase. In recovery phase, blood collect in SSGT or urine in sterile urine container, whereas in symptomatic, lesion roof with scalpel or plastic scalpel collected in plain tube, lesion fluid with intradermal syringe, lesion base scraping with sterile polyester swab, blood collected in SSGT 4 to 5 ml, blood collected in EDTA. Urine is sterile urine container. Now, how to manage Principle of management is patient isolation, protection of compromised skin and mucous membrane, rehydration therapy, and also nutritional support, monitoring and treatment of complication. Then how to patient isolate? Isolation of patient in an isolation room for hospital or at home in a separate room with separate ventilation. Patient to wear triple layer mask. Skin lesion should be covered to the best extent possible. Long sleeves, long pant. Isolation to be continued until all lesions have resolved and scab have completely fallen off. Then what are the supportive management of monkeypox? Like in case of skin rash, clean with simple antiseptic, mupironic acid, cover with light dressing. Do not touch or scratch the lesion. Genital ulcer, in that condition we have to manage by sitz bath. Oral ulcer, warm saline gargles. Conjunctivitis, that is usually self-limiting, and consult ophthalmologist if symptoms persist or there are pain or visual disturbance. Dehydration can occur in association with poor appetite, nausea, vomiting, and diarrhea. In that, we have to give ORS or oral fluid, IV fluid if indicated, or encourage nutritious and adequate diet. In case of fever, we give paracetamol as required or sponging. Itching or pruritus, topically calamine lotion or antihistaminics. For nausea and vomiting, we consider antiemetics, or for headache and malaise, we give paracetamol and adequate hydration. So that's all about monkeypox.